to the League of Women Voters Lunch and Learn for November 11th, 2025. It's Veterans Day. Let me say first that the League of Women Voters is a not-for-profit, nonpartisan organization, and we try to get good information for all of our citizens, as well as encouraging them to vote. So for today, for Veterans Day, we have Mary Pearson, and she is a licensed master social worker. She provides social work services at Salina's VA clinic, which the VA calls a CBOC. Is that CBOC?
Yes, ma'am.
Yes, which stands for Community-Based Outpatient Clinic. It's at 1410 East Iron, Suite 1. And over 7 years with the Department of Veterans Affairs, Mary has held positions with the PACT team, which I looked up. It stands for the Promise of Assistance for Comprehensive Toxics, and is associated with injuries from Agent Orange and burn pits and other military dangers. She's also been with the Homeless Department in the VA and the Veterans Crisis Line. In the Homeless Department, she worked to gain housing for veterans and provide case management services. At the Veterans Crisis Line, she talked with veterans in crisis. And now she helps veterans with home health aides, completing VA paperwork, answering billing questions, and finding nursing home care. She often engages with veterans' family members who seek support for their loved ones. And she works closely with home health aides and the VA staff, encountering a diverse range of veterans' daily needs. And she finds her role both challenging and fulfilling. Let's welcome Mary Pearson. Thank you, Mary.
If it's okay, I'll just sit.
Yes. Okay.
I was just thinking about when I started working with veterans about 7 years ago. Prior to that, I did child welfare. So I worked for child welfare at DCF, Department for Children and Families, for a long time. St. Francis, 10-5, that sounds familiar to all. But I wanted to work with veterans. My grandfather was a veteran. He passed away probably about 15 years ago. He joined the Army when he was 15. His mother signed for him, came from a very poor family. He was one of 8. And again, we were very poor. I'm from Mississippi, and he's from Mississippi as well. And his mom said, "This is an opportunity for you." So she said he was 18 and signed for him. And he left and went to Panama City, and was there for I don't know how long. But he traveled the world. They got to see lots of cool things. He came back when he was 21 and met my grandmother, and they got married. But I thought that was pretty cool to be 15. I can't imagine today's 15-year-old being in the Army. I have a 17-year-old. I can't imagine. He can barely, he doesn't know how to wash his own clothes. So I can't imagine that. But very cool story. But the VA, the Salina CBOC, we do a lot of different things. And a lot of our veterans really depend on the CBOC because the only other alternative for them is to go all the way to Wichita. So we have our tiny CBOCs. I look at the one in Salina. We have one in Hayes. We have one in Hutch. We have one in Dodge. And we have one in Parsons, Kansas. I think that's all the CBOCs that we have. We have social workers at each CBOC, and they're also staffed by PAs or doctors. Our PAs are physician's assistants, nurses, we have dietitians, so the veterans can come to us and get a plethora, or I don't know what a better word for it is, but they can get a lot of different services. And I think that they really appreciate having us. I know there's sometimes a little bit of disgruntlement, but overall, I think it's a good place and a good experience for them. I assist with what we have eligible for all of our veterans as home health aid. So places like interim, accessible home health, I was trying to think Spain County Home Health, we contract with all of them, and they send out aides to our veterans at home to assist them with bathing, grooming, meal preparation, things like that. Because a lot of our veterans have lost their wives, or their wives just can't help. Or sometimes, it's a wife that was the veteran and the husband just can't help because they have their own medical issues going on. So I help set that up, and that's for all of our veterans. So no matter who they are, because we do have some things that are exclusively for veterans that are service connected at a certain level. So if they were harmed while serving, they're therefore service connected and will get a different level of services. But fortunately, home health aid is open to all of them. And prior to doing the job at the CBOC, I worked with the homeless, and we have quite a few homeless veterans in Salina. A lot of people don't realize that. The homeless population in Salina, I think, has grown a bit over the years, and quite a few of the homeless population are actually veterans. And we have a program called HUD Bash, and that's what I worked for. And basically what our job was and is to assist them in getting housed and helping to keep them housed. And sometimes keeping them housed is more challenging than getting them housed, because keeping them housed, because they're quite a naughty bunch, our homeless veterans. They're typically the veterans who have more issues surrounding mental health. Sometimes they have substance abuse issues. So a lot of times when I was working in that program, I would get phone calls, so-and-so is having parties in the apartment, he's got to go, things of that nature. So they're the naughty bunch, I call them. But I loved every single one of them. They're great people, just a little bit of an and then prior to that, I actually worked at the Veterans Crisis Line. So I would take phone calls from people in crisis and veterans in crisis. And sometimes it would be people that weren't veterans, that are civilians. They would accidentally call the number, and we talk with them as well. But our goal was primarily to talk with our veterans, and we were there for our veterans. And so now it's kind of, I call my job kind of like a hodgepodge of different things. Like sometimes veterans will get bills that they can't pay, or they just don't know how to navigate the VA, because the VA is so massive and so confusing. I get confused every day, and I've been there for 7 years. So I try to help navigate that for them. Like we'll have a veteran, he said, my brother got a stair glide, and I want a stair glide. I don't understand my brother got one, but I didn't get one. It was really cute, because it was kind of like this brotherly thing. My brother got one, I want one. And so we had to kind of figure out who to talk to, how to navigate that, so that we made sure he got what he needed also. And he did qualify for it as well. It just was a matter of figuring out who to get to, who to talk to. So, but I love the veterans. They've enriched my life so much, and just made things so much better for our community, and have made my job a joy. They really do. So it can be a challenge at times, but overall, they really
You're in the right
things.
place. You are?
They
Okay.
really do make things fun.
You might have to speak up.
Okay. Yeah. Hi.
Hi.
Are you a veteran?
Yeah.
I don't know if I've seen you before. I'm a social worker at the Salina CBOC.
I've been over there a lot, but
Yeah. I don't know if we've ever met before in person.
yeah. But I do have some questions. when
Yes,
we get to
sir,
it.
of course. If you have any questions,
I was going to ask one question.
yes, ma'am.
Is there a special number for the VA hotline? Crisis
The
line?
number for the crisis line, and they changed it. I can't recall it. Yes, ma'am.
I have a question. My husband was in the Air Force and the Army and the National Guard. And how do you, as a person who is connected with active duty service and you retire, how does that interface? Because he could get some things from VA that the retirement benefits don't play together very well.
Yeah, it's confusing. It gets confusing, I think. Like, are you talking about maybe like when you talk about retirement benefits, maybe like service?
Well, he could get hearing aids from you guys,
Yes, ma'am.
but he couldn't get, and there was some other stuff that, the interface is very strange.
And
So how do you, as a retiree or a veteran, figure out where you fit in there?
It's confusing because we have what's called veteran service representatives, and they work for the state, whereas I work for the federal government, which makes things even more confusing. So our veteran service representatives, they can help with things like service connection, pension, aid and attendance, things like that, whereas I'm on the other side. And so I help connect people with the veteran service representative. So if
Does
there's
that apply to them?
Yes, ma'am. So anything that you have questions about, I mean, feel free to reach out to me directly because I can always point you in the right direction.
And that veteran service representative is right over by the VA.
Yes, sir.
Only it's, when you pull in the VA parking lot, you see a big, or low brick building there. It's the other side of that.
Oh,
His name is Mike Robin, and
Yeah.
he's by himself now, but yeah, yes, ma'am.
It's the 988
Yes, ma'am.
crisis line, that's for everybody, and then you press 1
Press one
and you
for
get the
veterans.
veterans.
And that's 24/7, 365. We worked on Christmas, Thanksgiving, weekends. I mean, somebody's always there. It's a really good resource. Yeah. But like I said, if you ever, I mean, if you like to get my number after this and you have any questions and want to call me.
are there VA benefits for beneficiaries? I mean, from,
I believe there are. That's a good Mike Robin question because I know that there are benefits. I think it depends on the level of how highly the veteran service connected. Depends on whether or not there are benefits for the family, but I believe that there are for wives and even for children.
be curious to
Yeah. Yeah.
find out.
Did you say you had questions?
Yeah,
What you thinking about?
well, my wife was diagnosed with, what was it, leukemia
Yes, sir.
about 10 days ago.
Oh goodness, I'm sorry.
And I didn't know where to, she's under treatment now, but I don't know where to go with all this.
So
Because
you're-
I could get her treated through the VA, or she's got Medicare. So,
is she a veteran too?
no.
Okay. That's where things get a little bit cloudy just because the VA focuses on the veteran, but a lot of times our veterans need help for their spouses, so I completely understand that.
Yeah.
And so things get a little bit, it's a
Well,
little bit
I
difficult.
think Medicare is pretty good with it.
Yeah,
So
yeah.
she's, bad part is, the only place she could be treated really was Kansas City or Omaha.
Oh, wow. That's
And
hard.
our daughter lives in Omaha, so that's where she's at. Because that'd be a lot of driving.
That is a lot of driving. Yes, sir. Was there anything else that, anybody else have any questions or anything? Or anything they want to know about as far as the VA goes?
Can you talk about maybe what progress has been made with the actual problem of suicide among veterans?
I think a lot of progress has been made. I know we have a long way to go. I would say that the Veterans Crisis Line has helped a lot of people, especially our younger veterans, it seems. I feel like having that outlet 24/7, has been a lifesaver for many of the veterans who feel like, and I know in my experience when I talk to the veterans through the crisis line, they felt that they can't necessarily speak with their families because they don't want their families to know what's going on or how they feel. They don't feel comfortable, so talking to a stranger sometimes is better for them than talking to a spouse or a significant other, boyfriend, girlfriend, mother, father. So I think that as far as like hard data, I don't know off the top of my head. I just do know just from what I've learned in talking to others through the VA who have worked on the Veterans Crisis Line and who currently work there, that there has been a lot of improvements made and a lot of people that have been helped. I'm glad that we have it.
Are there support groups for the veterans, for the guys, and women to meet, like on a regular basis, just to, it'd be kind of like an AA meeting for alcoholics. Not that, I'm not talking alcoholics, but I'm talking just a support group where they can talk and field.
Yeah, they
Do you
have
have that?
At the VFW, I know that they had a support group at one time. I don't know if they still do. At the clinic, we haven't had a support group in quite some time. We had a therapist that left, but before she left, she had a PTSD group. The VFW, I want to say now, still has those groups, but I don't know for certain. We do have caregiver support groups because we have a whole program called caregiver support, and that's for veterans, spouses specifically. And caregiver support works one-on-one with husbands and wives of veterans to help support them in their role as a caregiver, which is kind of cool. So we have veterans who have significant medical issues, significant mental health issues, and we actually have a program where the caregiver, to avoid burnout, can go talk with their support group and have that support and have a social worker. They even have a social worker assigned to them, which is really cool. So the social worker goes out to the home, visits with them one-on-one, and just kind of stays in the loop and make sure that they're doing okay, make sure that they have what they need. Sometimes they get forgotten in the mix, so we do have that.
Okay, let's say that you are either recently separated from being active duty, or maybe you're like 55 and you used to have access to health care, but suddenly something's changed for you and you've never used the VA system before. How do those people get into the VA system?
That's a good question. The first thing that they do, it used to be a task of coming into the CBOC where I work and filling out paperwork, but it's changed a little bit. And now that our veteran service representatives, Mike, the location you were speaking about, he actually helps them complete the paperwork that's necessary to get enrolled. So it's kind of, you know, the paperwork is kind of probably not a lot of fun, but the good news is that Mike helps them complete these various forms to get the ball rolling, to get them enrolled. And then once that veteran's enrolled, they get assigned a doctor, a nurse. I'm not a social worker there, so I'm there for them. And they get assigned a dietitian if they want the dietitian, so they get assigned various different people to help them. And they can come in, you know, whether they're fresh, new, just left service, or whether they're 80 years old, they can come in and work with us and we'll help them. So, but the process usually starts with the veteran service rep.
So talk a little bit about transportation. Let's say I'm a veteran and I've been referred to a doctor in Wichita at the VA there, but I don't have transportation. Talk about that.
Well, for some of our veterans, unfortunately not for all of the veterans, but for some of the veterans, we can utilize what's called beneficiary travel. And so basically, if a veteran is service connected, I believe, at 40% and above, the service connection all goes back to their time in service, whether they were harmed, like I said, you know, had harm while serving, had exposure to toxic chemicals, things of that nature. But we can have beneficiary travel where we contract with an agency that actually goes and picks the veteran up and brings them to their appointment. That's what we usually can do and work out for Wichita. And then locally we use a lot OCCK, which has been awesome because they're like a lifesaver and they're really good. They come pick up veterans from home, take them to the CBOC and back home. They charge like $2 each way, and it's really nice. And so we rely pretty heavily on them. Yeah.
I had a question. Can you give us any of your experience with the PACT group? And did you see Agent Orange or burn pit injuries, that kind of thing?
I've never seen that before, but I've met quite a few veterans who've been affected by. I met a gentleman who had some pretty severe medical symptoms because of exposure to toxic chemicals and had really struggled his whole life. And he said to me, you know, I was drafted. I didn't want to go, I was drafted. So he said, they made me go, and then I got sick. And so his story was very tough to hear because, like he said, he was 18, he got drafted, he went and did his duty for his country, and then he got all this exposure to these chemicals, and then came home and really struggled for his whole life. And so when I met him, it's probably late 60s, early 70s, and he had been through a lot. So that's probably the story that sticks out in my mind whenever I talk about or hear about.
And what would be your part in that? Just to listen to him or to send him to the right services or what?
Well, basically, I would kind of be there for anything as far as listening, making sure that he is getting to the right people for the right services if he needed. Home health aid, which is what he needed when he spoke to me. Helped him. I did an assessment, basically asked him questions like, what do you struggle with as far as grooming, bathing, things of that nature. And then once we assess for that, we actually do what's called a, oh my goodness. The word slips my mind. But we basically do, after the assessment, we do a request for services. And then that way he can have somebody come into his house for a certain number of hours a week, up to 16 hours a week, home health aid. And so that's why him and I were speaking. And we got that set up for him. And I remember him being, as all veterans are, I've always been really grateful for that care. I don't know if they've always done home health aid, and I don't know if it's always been around, but I know since it's been around, it's been a big deal. Because they don't have to leave their homes. They can have somebody come in and even make them meals, things like that. Even just kind of pick up their home and clean a little bit because they can't do it themselves. It has been a game changer. So I know it's been important.
I just read, I'm reading a book by Bill Curtis, the announcer, TV guy from back from the 60s to the 10 years ago or so. And he went to Vietnam, and that's the first, I mean, this was as a reporter, probably a couple decades, I think, after the Vietnam War, and finally got somebody to notice that the Agent Orange was causing health problems, which I guess it caused massive health problems in Vietnam and pretty significant ones in American vets.
It's a big deal. I think that a lot of people didn't realize that, the burn pits, things like that it was such a huge, it impacted so many veterans to a level that I don't know people really realized. And we're still realizing it now, more and more.
So if a veteran believes they either had Agent Orange or burn pit exposure and they want to get benefits for that, the person they start with is
Mike Robin, who works, and that's who we have locally in Salina. And then we have other veteran service representatives in other locations. So if they don't get what they need from Mike, or if they don't get what they need from Mike, then they can always call me back up, say, hey Mary, is there somebody else I can talk to? And then I can share a different name and number. And that's how they get the ball rolling as far as with benefits and compensation, things like that.
And Mike's, he's the state guy?
Yes, ma'am. He
So
works
it's
for the
something
state.
like this, Kansas Veterans.
That's my problem.
Yeah, what's it called? I mean, you
He's
can't
a
just look up Mike
veteran.
Robbins.
Veteran Service Representative, so they call him like a VSR for short. But he works really close to where we work actually in Walker. He's a guy. He's a veteran himself. But that's what they call him, as veteran service reps, and they work for the state. And that is kind of confusing for the veterans sometimes because they're like, well, he works for the state, doesn't have anything to do with us. And I'm like, well, no, he does, I promise. It's just different.
I see it's called Kansas Office of Veterans Services.
Yes, ma'am, that's correct.
So that's
Yes.
where he works, which is next door to the.
Yes, ma'am, it's like basically a
Yes.
walking distance.
Mhm.
I walk a lot of veterans over there. And I go visit with him, and he's a super nice guy. He had help, but that gentleman went to a different job, so he's on his own now, so he's a little bit busy. But he's a good guy. He's really, really knowledgeable.
what does the VA have to offer to a beneficiary who's maybe already on Medicare and gets quite a bit of his services covered by Medicare, but maybe he's finding meds hard to afford or
The
other
VA
things?
will provide medications to our veterans. They provide whatever medications that they need, the VA will cover those, and we'll actually send those out in the mail to the veterans. So I don't think there's any medication that the VA won't cover for our vets.
It has to be on the VA formulary,
Yes, ma'am.
and that can be a sticking point sometimes.
Yes, ma'am. is. I mean, it's a really supportive place. It's full of really good people. I always tell people I may not know the answer to the question, but I can always find out. Because it is such a hard place to navigate. Sometimes it gets a little bit murky. But if they start with me, come to me. I can email, instant message a few people, find out who to go to. And it may take a little bit of time, but it gets worked out. Sometimes that's not me. I'm not the right person. I have to go to the next person, but it gets worked out.
How did the federal shutdown affect you guys?
It did not affect us. Fortunately, it did not affect us. From what I understood, we were already funded before the shutdown happened. So I'm so glad, because our veterans don't have to be worried about that. We don't have to be worried about not getting paid. So it's kind of nice. It was really nice. I know a lot of people weren't as fortunate, but yeah, we didn't really see a whole lot of effect from that.
Okay. Do you have any idea how many veterans you see in a year? Not just you, but the clinic?
Oh my gosh, hundreds. We have a very busy CBOC. We have, like I joke with the Dodge City social worker, because she's out in Dodge, and I don't think she sees quite the traffic that we see. So I don't even want to guess. We have a lot of veterans that we see every year. A lot of faces we see, more often than others, just because they have more needs. But this Salina CBOC stays pretty busy.
What inspired you to follow this type of work?
Well, I did child welfare for a long time. And doing child welfare, you get a little bit burnout just because, and you're going into some dangerous situations, and sometimes it gets a little bit overwhelming. You're kind of going into situations that sometimes the police don't want to even go in the situation with you. Like when I did child welfare, I remember calling, "Can somebody come in with me to this house?" And you don't need to go in there, we're not going in there either. So I kind of got a little burnout on that and decided to shift. But I was raised by my grandparents, and my grandfather, who joined the Army when he was 15, kind of inspired me to want to work with the veterans. Because, he was a pretty great guy, and he had a lot of really good experiences, a lot of good tales. When he left at 15, he was a typical 15-year-old boy. He came back with tattoos all up and down his arms and stories to tell. And he had a tattoo of a woman on his upper arm. She had a snake wrapped around her, and at the bottom it said, Vic, V-I-C. I said, "Well, Papa, who was that tattoo for?" He said, "Well, it's for a girlfriend that I had. Her name was Vicky." "Well, why didn't you finish the name? You just got to get..." It started hurting too much. So I got the whole thing in V-I-C, but just couldn't quite get to 3 more letters in this. So he really inspired me to want to work with veterans, and it's been an honor. It really has been. They're some great human beings, and they've got great stories to tell. And some of our veterans are they're lonesome. They've had wives pass. They don't see their kids as often as they want to. They'll call and tell me their stories, and they'll say, "I'm writing a book." I say, "You should. I'll buy it." We've got a couple of veterans who have written books. It was pretty cool.
Do you have, in that large group, I'm an addiction counselor, so I'm wondering, is there a number of addicts, alcoholics or drug addicts in your big group? And do they have support groups or?
They do. Unfortunately, we don't have a lot of support groups through the VA in Salina, but we do have a plethora of them in Wichita. It kind of stinks because in Wichita, there's so much more available to the veterans than there is compared to our Salina veterans, which can be a sour point for a lot of us. We do have, I would say, most of the people, veterans who struggle with addiction issues are younger vets. I've noticed that probably the age group of 40 to 20, around that area, seems to be the people that have a lot of struggles. And sometimes I don't know if it's an age thing. I don't know what the theme is, but makes, that, has created this kind of cloud of our younger vets who are struggling more so than our older vets. But there is support. Unfortunately, it's just kind of far away from Salina, which is, an hour and a half, so.
Of course, they can be involved in the local support area and that kind of thing.
Yeah, we refer a lot of people like to CK, yes, to them, and because then they can get that help locally. And because we have care in the community, the VA will pay for that, which is amazing. So the veteran doesn't have to worry about paying for that help. They can go and get help that they need in the community with the VA assisting with that. So it's a pretty awesome thing.
Any other questions? Do you have any other questions?
Yeah,
Yeah, have some.
Yeah.
I'm entitled to the VA medical benefits.
Yes, sir.
Which my wife is too. And we're both covered under Medicare.
Gotcha.
What I would like to do is just get under Medicare and have VA do the 20%. You see what I mean? Or under Medicare, they pay 80 and you somehow pay
Gotcha.
20. And I have a backup insurance now to cover
Okay.
that, but that's getting expensive.
Yes, sir. Kind of like a supplemental.
And I don't know whether the VA does that or not. I mean,
I'd have to do some more research on that. I will give you my contact information and let me do some research with my supervisor. Because I'd have to ask them kind of how that works. It's a good question. I just need to learn a little bit more about it.
And where's your supervisor? Is that somebody that's here? or-
She's in Wichita.
Okay.
So we're kind of out on our own little island. So all of our supervisors, everybody, whenever we have anything important going on, we all have to get on our computers and Zoom things because everybody's in Wichita and we're just kind of here in Salina on our own. So we call ourselves the islands, the island of misfits, the toy misfits, because we're just kind of just here. And so they'll hold little parties and things like that. And we're like, why did we get invited, but we don't want to go all the way to Wichita, so we'll have our own party in Salina. So
Overall, how many staff are here in Salina?
there's probably, we have a chiropractor too, and he's new. I would say there's probably in the building 30 to 50 of us on staff. I might be saying too high of a number. But we have quite a few nurses, quite a few teams. There's 3 teams. There's a nurse practitioner team, and then we have 2 physician assistant teams. And so then they have their own nurse and their own people that work with them. And then, we have our other folks. And we have home-based primary care too, which is a program where they have doctors and nurses actually go into the home and do what they would do what the veteran comes in for, they do in the home instead. So for our veterans who really just cannot get out and can't do things, they'll go to the home and do the doctoring and the nursing and social work and all that good stuff. And they travel to the homes and all kinds of weather and all kinds of things, they're out there for our vets. So.
Are there, this may be way off the ball, but are there opportunities to do any kind of volunteer?
I wish that the big thing that our veterans want, bless them, is housekeeping. And so I wish that we had more volunteers that would assist with housekeeping and then yard work. So I think there are people that volunteer through the VFW, but there are people that will call me every so once in a while and say, how can I help? And I'll connect them with a veteran who cannot do their own housework anymore, or cannot do their own yard work anymore. As far as having regular volunteers, unfortunately, we don't. I wish that we did. That would be a huge help, because like I said, the poor veterans, bless their hearts, sometimes they just need somebody to come clean their house and cook them a meal, and they just don't always get that, and that's really unfortunate.
If a person needs that kind of help, the house, do you hook up with people like Accessible
Yes, ma'am.
but they're gonna have to pay for it, or,
The veteran doesn't have to pay. What happens is for home health aid, which I help connect the veterans to Accessible or Interim, any agency that we contract with, they can help the veteran. The only caveat to that is they can't go over just to do housework. So the VA will pay for it as long as the veteran's getting some sort of other care, like grooming or bathing.
so if you fit in the right category, it is
Yes,
covered.
ma'am. So if you fit in the right category, it's covered,
Yeah.
and they can always housekeep, as we say, as time allows. So a lot of veterans have benefited from it, because it also kind of gives them somebody to talk to and visit with, and then they get to kind of have like a companion coming over a couple.
Because sometimes you can jimmy it around a little
Yes,
bit
ma'am.
so that they do fit a
Yes, ma'am.
category.
Sometimes I try to figure out the magic so they can get it.
Because I know that trips a lot of people up. They can stay in their house, but you can't stay in your house
Yeah.
with it just accumulating.
We try to kind of, we do whatever we can on our end to jimmy it around, or, make the puzzle pieces fit so that the veteran can get what they need.
I didn't know you interfaced with that or not.
Yes, ma'am.
That's
Yes, ma'am.
cool.
I help with that a lot, yes.
Do you work at all with Agency on Aging?
I talk with them every so once in a while, and they're a really good resource. They actually did a training with us recently on dementia, and so they're really good folks. They have a wealth of information, and I talk to them mostly whenever I have veterans who don't necessarily qualify for home health aid, like the grooming, bathing needs, and they really only qualify for the housekeeping only. They help a lot with that.
Yeah.
And unfortunately, the VA won't cover it, but they can help connect the veteran.
I wish I'd known about you guys when my dad was going through
Yeah.
stuff, because we did go down to that place on Iron, and there was a lady there, and 3 trips later, I didn't get any satisfaction. And I don't know, had I known there was another place I could have gone, I would have for my dad. And then after he passed, we found out about Agency on Aging, and they do a lot. They did a lot for my mom.
They're awesome.
Yeah.
They're really awesome. I always try to tell folks, if they're hitting the wall or they don't feel like they're getting what they need, I always, let them know they can always contact me. And if I can't necessarily answer the question or meet that need, I'm always going to try to figure out somebody within the system who can.
Yeah.
It's so important.
There's so many places that people just don't even know that it is a resource for
Oh,
them.
yeah.
You don't even know the questions to ask to find out the answer.
Yeah, or who to go to ask.
It's
Yeah.
tough. And the VA is such a hard place to navigate. I mean, it really is. It's just such a massive place with just so many different facets and different people to talk to, and you just never know who the right person is to go to. So if you call the number that you don't know who to ask for, so I try to help people navigate. That's what I do a lot of my job as a social worker, is kind of helping people navigate to find the right people to talk to.
And a lot of times, my dad's age of
Yeah.
generation, they didn't talk about stuff. So he always told me when he passed away, there was a folder, the vets would take care of everything,
Yeah.
blah, 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 and that's not what happened.
That's a,
Didn't know it until it was too late.
Yeah,
Right.
yeah.
and he wasn't there to ask in
Yeah.
particulars, so.
It's just, it's disheartening sometimes how hard the VA can be to navigate, because it's just so.
Especially if they served like 2 years. They were drafted and served for 2 years or whatever. It was just a part of their life and they moved on, and
Yeah.
you didn't even know that was even available. You
Right.
didn't know they
They
were
were too
even,
young to even think about
right.
Yeah.
future.
Yeah. And a lot of the veterans of this generation will downplay their needs and say, well, I don't need that. So when I do assessments, they say, oh, I can do everything on my own. I can cook and clean, and I can bathe, and I can dress myself. And when you talk to their spouse or you talk to their daughter or their son, they say, I can't do any of those things. And so it's because they don't want to admit that they need help sometimes. So that's hard.
Did you have any more questions from you?
Oh, this kind of, it's a question. Under the chemical stuff that the VA, that new one, like gasoline, oil, whatever. I spent a whole year pumping gas and jet fuel into equipment,
Yeah.
and I haven't registered for it yet. I didn't know anything about it, and I'm already 90% disabled, so
Okay.
it's,
That's really good
yeah.
yeah, thank you for your
That-
service. Yeah.
I had to fight from
Oh, yes.
2012 until last year I got.
It's a challenge. I
Yeah.
would talk to Mike about if you feel like that you have something that could qualify for that 100%, always go for it because you never know.
Oh, that was another question is,
Yeah.
should I push it that hard to get 100%?
Heck yeah, I would say so. I've known many veterans who got up to 90 and have kept going and made it up to 100%. You know, it's a real challenge and they can sit there at a number for many years and then if they keep going, it happens for them and it's huge financial relief. So
Yeah.
definitely go for it.
I was looking and they got me like 40% for amputation,
Yeah.
50% for, I'm not sure what the other 50% is, but I have half a dozen other problems that
Yeah.
I filed a claim on, they didn't even answer.
Yeah. It's so frustrating.
They
It's a
can-
frustrating experience for all
I
of
take
us.
it you didn't retire.
No. I skipped out the side door when they handed me my paperwork. Didn't look back. I thought 4 years is enough, I don't
Oh,
need to do
yes,
any more than
sir,
that.
for sure. Thank you for your service.
But actually, I enjoyed the work I done, it just, the military side was not good.
I've heard that many times.
Or I wasn't made to be military, one or the other.
Yeah. That's okay.
Well, let's give her a hand, and if anyone wants to ask more questions, they can talk. Mary Pearson, social worker at the VA. It's November, we don't have a lunch and learn in December, but we have one in January. I think we haven't invited the person we think might be talking that day, so we won't tell you who it is. But it's the second Tuesday in January, which comes up really quick after New Year's Day. And so we hope to see you back then.